Hi guys, I'm Dr. Jared Marks. I'm an emergency physician, and I'm coming to you today from the University of Nebraska Medical Center, the Davis Global Center with iEXCEL. And today we're going to be reviewing how to do a thoracic ultrasound and drape the patient appropriately so that they're not exposed. So when we're doing the thoracic exam again, we're going to put on gloves so that we have our personal protection, but also because we're going to be working in a sensitive area and don't want skin on skin. Additionally, our patient may be in respiratory distress. They could be sitting up and need to be in that position, but we can do this same draping technique in a supine or a sitting position. What we're going to go ahead and do is undo the first two buttons of her gown to expose the chest. Again, our goal is to keep the breast covered as much as possible, and especially the nipple line. And we can bring that down, expose the top part of the chest so we can do the exam. We're going to apply gel to our probe. And we're going to start in the mid-clavicular line. I'm going to start on her right anterior thoracic chest. If you have a microconvex probe, that's usually the best, but we have a curvilinear, so that's what we'll be using today. We're going to place the probe right into the mid-clavicular line. Get our depths and settings as ideal as we can. I prefer to have about 10 centimeters deep to the pleural line. So we can see here that we're about 1 to 2 centimeters. Currently I have it set at 11. And what I'm going to do is evaluate these intercostal spaces for lung sliding. Now keep in mind at the apex sometimes they don't have as much lung sliding because they don't have to recruit that. So Amy, go ahead and take a big deep breath for me. So you can see a little bit of lung sliding through there. Go ahead and blow it out. We can appreciate lung sliding across that area. Once we've evaluated that area, we can then drag the rib that's on the right side of the screen to the left by dragging inferior. We can then get 2 new intercostal spaces, and we can watch again for our lung sliding and or any pathology that exists. If we get to this point, we've archived our images. We can then continue even further inferior. On the right side, we will start to run into the liver, which we'll find on patients. And once we get to that point, we've completed examination of the right side of the chest. We can then move over to the left side. I'm going to apply just a little bit more gel. Again, we're going to start in the mid-clavicular line. And I'm going to appreciate these most superior rib spaces that I can. I'm actually going to adjust the depth just a little bit to appreciate her lung sliding. We can also see what's called a lung pulse in this exam. And then we're going to drag inferior. Again, looking at the next rib spaces, we've got rib, and then lung sliding. Because I can feel with my hand that we're hitting down, I'm going to put that kind of over the top of the probe. And then I'm going to drag inferior. Once we start to see cardiac motion, which we see in this area of the screen, we know that we've evaluated everything we can on the anterior chest. And we're going to go ahead and pull the gown up. We're going to clean off our probe. Place it in the probe holder, and we're going to wipe off the gel off of our patient so that the gown does not become soaked. Then we can bring the gown back up and do up the buttons. Once we've completed that portion, we can go ahead and have her put her left arm behind her head. We can do either left or right next. That's dependent on what you want to do. We're going to bring the gown up and fold it across her body, kind of like a triangle. That allows us to see her lateral body. We're going to go ahead and take the probe and reapply gel to it. Make sure your hands are clean and the probe is clean. Otherwise, we want to go in the mid-axillary line. And I'm going to use the gown to help move any of the breasts. We're going to go mid-axillary line, probe marker towards the head. I'm going to bring the bed up just a little bit easier so I don't have to bend over so much. In this mid-axillary line, again, we're going to evaluate as many intercostal spaces as we can. I'm going to drop my depth a little bit. Actually, I'm going to keep it here so I'm at about 10. Her lung is right here. We see the pleural line here with rib spaces, and then I can drag inferior To move down to the next rib spaces, we can see our lung sliding, which is very subtle in this case. As she's not working to breathe hard, we do not see a lot of it, but we can see that lung sliding going back and forth there. We're going to continue in the mid-axillary line until we hit abdominal contents, which we start to see come in on the right side of our screen. This being lung on the left with our pleural line. Once we see abdominal contents, I'm going to actually slide to, on the left side, I'm going to slide to a posterior axillary line. I'm going to increase my depth just a little bit, adjust my machine settings, and I'm going to try to bring in my spine line here and then evaluate up into the diaphragm. In this case, I've got some darkness coming down from the screen, so I'm going to go ahead and reapply just a little gel as needed. Place that back into the posterior axillary line and make that ideal view as much as possible. In this case, I'm going to decrease the gain. You can turn back on things like tissue harmonics, which may help improve the view. But in this case, I can see spine line coming here and then diaphragm. And all I'm looking for is not lung sliding back in this area, but I'm looking for any signs of pleural effusion or pleural fluid, which she does not have. We can also see the lung sliding coming in from the lateral to medial portion and can appreciate that she has lung sliding. Go ahead and take a breath in for me. You can see that come in and move everything down. Once we've completed the left side, we'll put the probe back into the probe holder. I'm going to reach across the patient, clean her off as well as I can. Take her gown and re-drape it down. Let her bring her left arm down. I'm going to have her bring her right arm up. Again, I'm going to take the gown, keep her legs covered, take the gown across her body so I can see her lateral chest wall and keep the breast covered. I'm going to go ahead and apply just a little bit more gel to my probe, so I have that left over from the other side. Probe marker again towards the head. We're going to get up into the axilla as much as possible. Moving the breast out using the gown to help us. And I'm going to adjust the settings so I can see appropriately, watching for lung sliding, which is a little more obvious on this side that we can see with that sliding back and forth in those intercostal spaces. Right here at that pleural line, we've got rib, 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 and pleural line. Once we've evaluated that space, I'm going to drag inferior, looking for the next intercostal spaces, still in the mid-axillary line. Here we can see 1, 2, 3 intercostal spaces, and we can appreciate that there's lung sliding occurring at those. As we continue inferior, if it becomes black from the top of the screen, that means we need to apply some more gel. I'm going to get a little more gel here. We're going to stay in that mid-axillary line, and I'm going to be looking to identify her liver and her lung base. So we're in that mid-axillary line. I can see liver start to come in on the right side of the screen. I'm going to turn the gain up a little bit. Once we hit that liver, we can stay in that mid-axillary line, but now I'm going to increase my depth. I'm increasing the depth so I can see my spine come in, or her spine come in here and disappear into the diaphragm. And then we can look in this space for any pathology. She has what's called mirror artifact right now. We're seeing both liver on both sides of the diaphragm. That's a normal finding. If we see the spine continue above the diaphragm, that would mean there's pathology. And fortunately, in this case, it is normal for us. We can see her lung come down and erase across the top. That's our good lung sliding laterally. So once we've completed those and archived any images we need, we can go ahead and clean off our probe, place it back in the holder. We can then take our towel and clean off our patient. And we're going to go ahead and cover her back up, pull her gown down. You can go ahead and bring your arm down. We can adjust the head of the bed as needed for her so she's in a comfortable position. And then we're going to lower the bed down, and that brings us to the conclusion of our thoracic ultrasound exam.